I recall the moment that I decided to be a neurologist, actually, and it was one of my old bosses. He brought into one of these big case meetings. We like these kinds of meetings in neurology. And he brought this case, really complex, really big fat set of paper notes. And he'd been thinking about this case for ages, very senior, very experienced neurologist. And I thought, well, if somebody like that has got enough interest, still cares enough, still feels challenged enough by a case like that to bring it to discuss with loads of people, then it's probably the right specialty for me. It's very interesting and it's very varied. I mean, you have opportunities, from an intellectual point of view to sort of reverse engineer the brain and how it works, which is obviously very interesting and very exciting. You also have got a wide spectrum of patients. You've got people who've got, we treat everything from headache to dementia to epilepsy to Parkinson's, a whole host of conditions and types of people from, various backgrounds, different demographics. So, it really is a very sort of fascinating subject area and one that is sort of, very much growing in terms of the things that we can treat. So it really is, it sustains your interest and, we're getting better at, providing more options with regards for caring for our patients. So in that way, it is really very exciting. Like most neurologists, we are sort of master history takers, and by that we sort of delve really deeply into why the patient is there, what is the problem, all of the elements of the person, not just about their symptoms, but the way in which it's affecting their life, way it's affecting other members of their family. You're looking at sort of the whole broad picture to try and get to sort of what the bottom of the problem is. So there'll be a fair amount of time where there'll be a lot of conversation, a lot of question asking, a lot of opportunity to ask me questions as well, and then followed by a rather detailed examination of the neurological system to try and put all of these pieces together to try and work out what the problem is. So it's not just a matter of what's the underlying pathology, but how that pathology then comes to affect that person in addressing both of those problems.